This short video explores how mental health professionals interpret the phenomenon of jinn possession, particularly within Muslim communities. The videos, including this one, posted on this channel are intended for educational or informational purposes only. We do not provide medical or clinical diagnoses, nor do we offer treatment recommendations. If you or someone you know is experiencing mental health concerns, please consult a qualified healthcare professional.
The culturally sensitive approach to mental health challenges the dominant psychiatric view that often dismisses jinn possession as superstition or delusion, arguing instead for a culturally sensitive and spiritually informed approach to mental health care. There are several key themes in how jinn possession is understood clinically. First, many mental health providers interpret it through the lens of psychiatric diagnoses, such as schizophrenia, bipolar disorder, or dissociative identity disorder. For example, in 2015, Lim, Hoke, and Blom found that over 66% of individuals claiming jinn possession met criteria for psychiatric disorders. However, other scholars argue that jinn possession should be seen as a culture-bound syndrome, a culturally specific way of expressing psychological distress. This view encourages clinicians to consider the patient's cultural and religious background rather than pathologizing their beliefs. In evidence-based literature, jinn possession is interpreted as an altered state of consciousness or trance. Many scholars suggest that possession may involve dissociation, where the individual experiences a loss of agency or identity. Islamic concepts like wahm, translated as illusion or suspicion, are used to bridge psychological and spiritual interpretations of these experiences. Another perspective presented is that jinn possession may reflect emotional dysregulation. Boutwell et al. 2021, although writing about horror films, describe possession as a metaphor for intense emotional states, such as rage or anxiety, that overwhelm the self. Mental health professionals usually examine the symptoms commonly associated with jinn possession, including hallucinations, memory loss, aggression, and altered consciousness. These symptoms often overlap with psychiatric conditions, but their interpretation varies widely depending on cultural and religious beliefs. There are risk factors such as trauma, social isolation, and postpartum complications that also need to be considered. Rashka in 2017 and Rasht in 2018 note that many Muslims attribute mental health struggles to jinn possession, particularly when conventional treatments fail to address their needs. In terms of treatment, many Muslims turn to imams and traditional healers who use ruqya, Quranic incantations, and other spiritual practices. Muslim researchers and healthcare practitioners have documented the growing popularity of these methods, especially among youth. While some religious leaders caution against relying solely on spiritual remedies, others advocate for integrating traditional healing with psychotherapy. Isgandarova also proposes a holistic approach that combines conventional therapies like narrative therapy and psychoeducation with culturally grounded practices. She references the FERHA model, fear-reducing holistic approach, developed by Yale in 2021, which emphasizes building trust, reducing fear, and recognizing the role of imagination in the healing process. Why? Ultimately, the article calls for a more inclusive and respectful clinical framework that acknowledges the spiritual and cultural dimensions of jinn possession. By integrating traditional and modern therapeutic practices, mental health professionals can offer more effective and compassionate care to Muslim clients.